So the idea for critical thinking is almost similar to doing grand rounds. The idea would be to give you some didactic education on specific topics, spend a good bit of time talking about history and what the history has. The idea is also to try and get an idea, is it neuromuscular headaches, is it musculoskeletal, is it neuropathic, what exactly are we dealing with? The better way to learn this would be to do case studies. And what I will do is present actual patient cases and have you ask me questions as if you were the interviewee and I the patient, and have you come up with a differential diagnosis and come up with a treatment plan. With critical thinking, I'd like to give you the opportunity of basically seeing what a whole flow looks like. From the standpoint of the patient coming into the practice, from gathering the relevant pieces of information, as well as you sitting and taking the time to ask the appropriate questions and interviewing these patients. The answers to why the patient may be in your practice would be in the history. The idea for the history is honestly to get to the mystery of why the patient's in your practice. Once you've achieved that, coming up with a diagnosis by doing a clinical exam and spending some time discussing how a thorough clinical exam should look like and allowing you to perform that on each other so you have a better understanding of what exactly needs to be done to gather the relevant pieces of information to help you through your diagnostic process. Once you've come up with a diagnosis, I may ask you for a list of differential diagnoses. Once that's been achieved, I would like to know what you would do to treat these patients. In addition, I'll share what I did to treat these patients and also share the outcomes, whether it was a positive outcome or a negative outcome. And when we spend some time talking about dental sleep medicine specifically, you may have noticed that when you're managing some of your sleep apneas with oral appliances, treatment does not always go the way you predict it will. And what we seem to miss is other reasons why patients may still be fatigued or other reasons why they've not been able to manage. So with critical thinking, we are going to go through a step-by-step process to have a better, clear understanding of what we may have missed, what we may need to do in addition to the treatment that you may have proposed for your patients. So I hope you come and join us for critical thinking. But the whole idea for critical thinking is to try and get you to think through your cases and use the knowledge you have or expound on the knowledge you have to make you a better clinician.